This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dextrose 10% infusion is a critical medical solution used for hydration and energy replenishment. It is administered through intravenous means to ensure effective absorption. Indications and uses. This infusion is indicated for managing dehydration, restoring fluid balance in the body, and providing energy. It is also utilized as a diluent for various medications, ensuring their safe administration. How it works. Dextrose 10% infusion provides the body with simple sugars that quickly convert to energy while replacing lost fluids, playing a vital role in maintaining overall health. Directions for use. Administered only by healthcare professionals, the infusion is delivered into the vein as a slow intravenous infusion. The exact dosage and duration are determined by a physician based on the patient's age, weight, and health condition. Possible side effects. Common side effects include pain, inflammation, and irritation at the injection site, as well as potential changes in electrolyte levels and elevated blood sugar. Precautions and warnings. Before administration, patients should inform their healthcare provider of any existing conditions, such as liver, kidney, or heart problems, as well as if they are pregnant or breastfeeding. FAQs. 1. What is the use of Dextrose 10% infusion? It is used for fluid replacement and energy provision. 2. Is it safe? Yes, when used under proper medical supervision. 3. How is it administered? It is given intravenously by a doctor or nurse. 4. What precautions should I take? Inform your doctor of any medical conditions before use. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. Your feedback is appreciated.